reached out to close to 70 DGs, CEOs, presidents, and other heads of agencies that have potentially overlapping mandates with NIPRID. So I engaged people in the National Assembly. In fact, one of my best meetings was with the Speaker of the House of Reps. So as a result of that, as well as support from the executive and some key top leaders in the presidency, we saw a twofold increase in our capital budget. Additionally, we were prioritized when the COVID releases began. And so on the government side, that's a step in the right direction. It's nowhere enough what we need to do our work, but it's a step, it's a big step in the right direction.
Strategic collaborations and support from national and international organizations are vital to provide the required funding for research. One of such is the Japanese government support to NIPRID in expanding its nanotechnology capabilities.
The Indian government gave me close to 10 slots to train my staff abroad at no cost to NIPRID. As I speak to you, we've received equipment from the Japanese government worth close to 6 billion naira for the establishment of what I would say is Africa's premier nanomedicine laboratory.
Our activities in nanotechnology in medicine got to the what I call the current climax of winning an international grant from the Japanese government, which is worth about 5.88 billion naira, and it is directed towards developing nanopharmaceuticals for malaria, tuberculosis, and diabetes mellitus.
While international supports of this nature are critical, the most enduring and sustainable funding model for research development is a national and private sector-driven initiative. This will guarantee national health security and promote indigenous and efficient health solutions.
This board also elected to look into the aspect of the private sector funding coming to NIPRID. Somebody can decide to say, I'm giving this endowment with respect to cancer research. And before you know it, something will come out. It could be multi-drug resistant strains of a bacteria. I'm giving this donation for that purpose.
And that is where an opportunity lies for Nigerian and African institutions to step in. Because the Niprisan that we developed and has been used for millions of blacks and Africans across the world as the world's premier phytomedicine for sickle cell anemia is not being used by only the Adigwes of this world. It is used by all Africans and all black people that are plagued with sickle cell anemia. And so those philanthropists, those development partners, those funding agencies, those institutions that call themselves Africans need to step up to the plate and fund NIPRID, who has the capacity to bring out research that for diseases that plague our people using resources that emerges from our land.
The NIPRID's consultancy unit is strategically positioned to render services to research and development community, as well as interface with industry players. The idea is to ensure that research products and services can be uptake by the industry, provide feedback linkages, and boost revenue generation for the institution.
We've done a lot in the area of pharmaceutical drug testing for the pharmaceutical sector. Recently, we handled some samples from Emzor Pharmaceuticals, for instance, and then we've also handled for other organizations as well. We have specialized laboratories spanning from medicinal chemistry and quality control. We have laboratory in raw material development, and this laboratory are specialized in various forms.
As a Nigerian research institution with a Pan-African outlook, NIPRID has been integral to the conversation on maximizing the potentials of the Africa Continental Free Trade Area Agreement, especially in an era when the global dynamics of pharmaceuticals have gone beyond consumption to include production, access, and costs. The Director General of NIPRID, Dr. Obi Adigwe, was in Addis Ababa in 2019 to advance Nigeria's position in the emerging singular market framework for the continent.
In terms of number of manufacturers, we're up there. In terms of the quality of medicines that we produce, we're also right in front. My institute was the first one of the first that got its ISO 9001 as well as ISO 17025. And these are very, very well respected international certifications. We're also one of the first to sustainably transit to ISO 17025 version 2017. So, you know, these are some of the advantages that the Nigerian pharma sector has currently.
It is without a doubt that NIPRID, under the current leadership, is headed in the right direction, given the needed prioritization and adequate funding. It is on track in fulfilling the dream of its founding fathers of becoming a true center of excellence for pharmaceutical research and development in Nigeria and indeed the entire African continent. On the suburb of the capital city, Idu, Abuja, Nigeria, lies a world-class institution reputed for global excellence in pharmaceutical research and development. A similar tale of the proverbial phrase, "A prophet is sometimes not honored in his own country." In this documentary piece, we will take you on a journey into the exploits of Nigeria's foremost pharmaceutical institution. The National Institute for Pharmaceutical Research and Development, NIPRID, is a federal government agency established on 11th of June 1987 under the Science and Technology Act Cap 276. It became operational in January of 1989. The core mandate of the institute is to build a center of excellence in research and development of phytomedicines, pharmaceutical and biological products, drugs and diagnostics towards improving the health and well-being of mankind. In addition to undertaking activities relating to capacity building, policy making, data collation, drug distribution, and the development of contextual partnerships that can expedite access to health care. In its over 3 decades of establishment, NIPRID has demonstrated proven capacity, competence, and indeed the willpower to fulfill its mandate and meet the aspirations of its founding fathers.
The mandate of
Distinguished ladies and gentlemen, I'd like to welcome us all on board to this very epoch-making event, the first of its kind. It's been championed by the National Institute for Pharmaceutical Research and Development. An interactive webinar, which is titled Expediting Local Vaccine Manufacturing in Nigeria, Challenges, Opportunities, and Prospects. It is my singular honor to welcome us all on board this morning. Nigeria carries the highest burden of deaths of children under the age of 5 globally. About 2,350 children under 5 die every year in Nigeria. Nigeria ranks 152 out of 157 on the Human Capital Index, stipulating the fact that Nigeria is one of the highest contributors to the global burden of disease, accounting for 20% of global maternal deaths, and second highest burden of global under 5 mortality. Ladies and gentlemen, it is a great privilege today that we are all gathered together to talk through the topic, expediting local vaccine manufacturing in Nigeria, challenges, opportunities, and prospects. It is my great honor once again to invite us all, particularly on board our esteemed Director General of the National Institute of Pharmaceutical Research and Development, the lead agency. On this note, can we just please take a national anthem? Thank you very much once again. All welcome on board. Permit me to, on this note, welcome our esteemed DG, Dr. Obi Peter Digwe, who will be giving us the welcome address. Dr. Obi Peter Digwe has over 2 decades knowledge and experience in healthcare research, policy making, and management both in Nigeria and internationally. Dr. Digwe was recently conferred with the National Productivity Order of Merit, NPMOM Award, as well as the renewal of his appointment as Director General, Chief Executive Officer for another time of 4 years. It is my pleasure this very wonderful day to bring on board Dr. Obi Adigwe as he gives us the welcome address. You're welcome, sir. Over to you.
Thank you very much, Prof. Excellencies, distinguished delegates, ladies and gentlemen. It is my singular honor to welcome you all to this epoch-making event. As you all know, local manufacturing of vaccines has long remained a critical aspect where we've had significant weaknesses in our entire system. Secretariat, can you put up the slides I mentioned earlier on about where we started?
we've been talking about local manufacturing of vaccines for quite a while now. About a decade ago, shortly after I finished my postgraduate studies and I came back to Nigeria, I found out alongside colleagues that despite the fact that the Nigerian and indeed African systems had the greatest burden of vaccine preventable diseases, ironically, we didn't have any capacity to do anything about it. I think it was in 2016 or 2017 that we had a big outbreak of meningitis, and it was embarrassing for a lot of us that believed in local capacity. The Nigerian government literally triumphs the whole of the world trying to look for meningitis vaccines. And the screenshots that you can see there on your screens currently are some of the press conferences we gave at the time, roundly suggesting that we need to pay strong attention to this particular area. During that period, we were roundly vilified, but the evidence suggested that we were on the right path, and we kept on it. We kept on it because the evidence suggested that we needed to keep focusing on building our own local capacity to address our issues. Incidentally, COVID came along and proved us right, and the whole world saw the direction that we had been proposing the government to go forward. And then, thankfully, a lot of strong partners and a lot of strong policymakers emerged to support this direction. In that vein, permit me to welcome our Director of Food and Drug Services, Pharmacist Arabiana. I've been engaging with the ministry over the years, and I've worked with close to 10 directors of that directorate. She's has the credit of articulating and pushing forward the current local vaccines manufacturing policy that we are now looking to develop a roadmap for. I also want to, in the same vein, commend the current administration for the appointment of a brand new advisor in health. Dr. Mrs. Ibrahim Kolo is someone who we've worked with, and we think that this current administration's emphasis on developing an office and appointing someone with a varied experience, both development sector, public sector, subnational and national experience, will ensure that we can push through a lot of these initiatives. I also want to commend our partners in this particular initiatives. His Excellency, the Ambassador Plenipotentiary Extraordinaire of Bulgaria, Excellency Yanko Yordanov, and Her Excellency, the Ambassador of the EUD, Ambassador Isopi, as well as their teams, people like Professor Amor Ben Matthew, Doctors Ayeke and Oguche, and on my own side as well, Doctors Adebola, Agu, and Danraka, and Messrs. Onawawa and Balogun, who have all put together this particular program that we're currently engaging in today. A lot of you who have been articulating projects know that putting together something like this in a transition government is a difficult task. What we're seeing here today and the program we're kicking off today has been in the works for close to 2 years. We're looking forward to putting together a strong body of stakeholders and a strong body of policymakers that can enable us now begin to implement the policy that has now been put forward. We look forward to ensuring that the continued vigor that we've started with is sustained throughout the end of the program. And we will keep, you have our word that we will keep pushing until we get about 3 to 5 vibrant entities who not only manufacture vaccines for Nigeria, but for the entire African continent, and also building a sustainable environment and ecosystem that will support in terms of research, in terms of business, in terms of policy making that will support the success of these entities, building a framework that will ensure that the entire continent and the people of the continent benefit from us having our own capacity is one of the things that we'll also focus on doing. Your Excellencies, ladies and gentlemen, without further ado, permit me to welcome you all to this epoch-making event. And Mr. Moderator, Professor Kolawole, you have the floor. Mr. Moderator, I think you need to unmute yourself while I mute myself now.
We want to thank you once again, our esteemed DG, for a great job you've been doing at NIPRI. We can see that indeed a lot of things have been done. And we want to thank you for championing this local vaccine production, which of course you have been into this picture for a very long time. On this note, again, I want to say thank you for every one of us that are on board. And it's my privilege right now to take some special remarks. And we have with us this morning His Excellency, Ambassador Yanko Yordanov. He will be giving us a special remarks. Mr. Yanko Yordanov was designated as Ambassador Extraordinary and Plenipotentiary of the Republic of Bulgaria to the Federal Republic of Nigeria in 2021. The same year, he was designated as Ambassador of the Republic of Bulgaria to the Republic of Equatorial Guinea, Republic of Benin, Republic of Ghana, and Republic of Congo, respectively, with residence in Abuja, and appointed as representative of Bulgaria to the Economic Community of West African States. Mr. Yordanov, His Excellency, has a PhD in Legal Studies, International Law and International Relations from the Faculty of Law at Sofia University. It is my pleasure once again as I welcome for the special remarks from His Excellency, Yanko Yordanov. The floor is yours, sir. You have the floor, Your Excellency.
Hello, good morning.
Good morning, sir. You can go ahead, Your Excellency.
Thank you very much indeed. Let me first of all to underline that this is a project that is within the framework of the Team Europe. So Bulgaria and the EU delegation in Abuja stepped into this project, but I believe that this is a project that can be actually a testification of the fact that the EU as a whole and who EU member states are supporting Nigeria in different ways and the way they see the added value in. I want to thank the Ambassador Hisopi for her support and for the remarkable cooperation that the EU delegation is giving to this project as to all the other projects within the Team Europe. Also, my thanks goes to the NIPRD, the agency that is developing such a range of initiatives that are having impactful results on the ground in an area that is of tremendous importance, not only to Nigeria, but to the region as a whole. And I think that the project we are discussing today is actually having an added value, not only in terms of assisting Nigeria, but also in terms of building capacity for the whole region of West Africa. This is something which Bulgaria is aiming at always when we are contributing to such efforts, to to consider these efforts not only in a strict manner of helping concrete area to be developed, but helping the whole region, which is I believe, one of the most important goals in the EU MAV Plus initiative, under which we are supporting this project. I think that Bulgaria and Nigeria are sharing a long history of friendship and cooperation. But at the same time, this is the first project that Bulgaria has ever contributed to financially under the development cooperation in Nigeria. And I think that this is a huge step forward for the bilateral relations as well. And at the same time, this is a clear message to both the Nigerian society and the Bulgarian one, that we can find different ways and areas of cooperation as long as the willingness is there. And when I say this, I remember that when we started our discussions on this project, we were already in a time where actually we didn't have time. But we've succeeded in completing the initial stage and preparing all the documents in a very short time, which was remarkable and which was a testification that this project is of essence for us. And I believe that at the end of the projects, we will have a very good result and outcome that will allow us to say that Nigeria is already on the map of not only the consumers of vaccines, but the manufacturer in West Africa as a whole. I think those are the main value point of the project. If I have to see it from a political perspective, if I have to see it from the perspective of people-to-people contacts and the development cooperation as a concept, I think that it's a very innovative one, because it's basically triangular that involves the agency from Nigeria, the EU delegation, and Bulgaria itself. I think that's the future of this cooperation, which I believe it's not just a cooperation. The way I personally see it is an investment into a brighter future. And this is why I believe that this project will be remembered as a pioneering activity in Nigeria. Thus, the EU will be always praised for this important contribution. So in a political sense and in a sense of cooperation in terms of development, I would say that Bulgaria is very proud of being part of this exercise, of not only as a contributor, but also as a knowledge sharer. And I'm very, very happy that one of the most distinguished Bulgarian professors and expert in this field, Professor Spasov, is a panelist to this discussion. I'm sure that he will add a lot to this project in terms of his expertise and knowledge. So all in all, thank you very much for this, and I wish every success in the implementation phase of this project. Thank you very much.
Thank you very much, Your Excellency. We appreciate the special remarks and the bilateral relationship between Bulgaria and Nigeria. Because just as you have expedited, you have said in your remarks, it is also strengthened the national vaccine policy 2021, which Nigerian government has put in place. We thank you once again for these special remarks and this bilateral relationship. It's my pleasure also to welcome on board also Her Excellency, Ambassador Samuela Ispoy. Ms. Samuela Ispoy assumed duty as Ambassador of the European Union to Nigeria to the Economic Community of West African States on August 31, 2021. Until her current position, the Italian diplomat occupied the same position of EU ambassador at the EU delegation in Banjul, Central African Republic. Her Excellency works in close coordination with the 19 member states of the European Union, the diplomatic representation in the country. It is my singular honor once again to also request for special remarks from Her Excellency, Ambassador Samuela Ispoy. Over to you. The floor is yours, Your Excellency.
Yes, good morning all. So the Ambassador Izopi has had an unexpected event that prevents her from delivering this first speech. So this is Leila, Professor Leila Benamor Mathieu. I'm the head of human development at the EU delegation. I'll just start briefly my video so that you see me, but you know, because of connectivity, I switch it off. So thank you again for inviting us to this first workshop that we are working on together. I just switch back I'll switch off my video. But the Ambassador Izopi is really, I just wanted to add that the Ambassador Izopi is really keen on this project. This is going to be something we will put a lot of focus on in the next year. And we are so very happy that this workshop is taking place and that the project is launched at last. And she wanted also to thank warmly the Ambassador Jordanov for his commitment. I'll just switch my camera off. So good morning all again, Your Excellencies and dear Ambassador Jordanov, all protocol being observed. It's not my duty, but because it's not me that is organizing it, but I really wish to welcome you to this interactive webinar workshop on expediting local vaccines manufacturing in Nigeria, challenges, opportunities, and prospects. You are welcome, as the director mentioned, also on behalf of the European Union delegation to Nigeria, which is supporting the efforts that NIPRID is making. As you know, in Africa, only 1% of all vaccines administered are produced locally. The rest, 99%, are imported through mechanisms such as Gavi, the Vaccine Alliance, and UNICEF. As you know, also, Indian companies supply 63% of full use at a vast scale and low cost. These massive imports have created significant barriers to vaccine access and affordability and enormous health disparities between rich and low-income countries. That's according to the Center for Vaccine Innovation and Access, PATH. The COVID-19 pandemic has undoubtedly further revealed these health disparities, also due to low vaccine manufacturing capacity on the African continent. And the African continent was not the only one that was affected by low vaccine manufacturing, as you very much know. The current situation in Nigeria is not different from the rest of Africa. It has limited vaccine manufacturing capacity and capabilities, affecting the ability to respond to current and, of course, future pandemics and supply routine vaccinations. Historically, efforts to restore the Federal Vaccine Production Laboratory at Yaba, Lagos, which has been active between 1940 and 1991, was locally producing large quantities of vaccines against such illnesses as smallpox, rabies, yellow fever, for both Nigeria and neighboring countries. Unfortunately, these efforts have not yielded the desired results. As you also know, the past administration in Nigeria has attempted to domesticate local vaccine production by setting up a vaccine production company, BioVaccine, to boost the vaccine supply. This aim is yet to be achieved. Also, the government must be commended for the construction of 3 mega stores to fast-track the establishment of vaccine hubs in Lagos, Kano, and FCT. Each store will ultimately serve 2 geopolitical locations and have the structure for storing and preserving vaccines and other medical equipment needed for immunization. In 2022, our president, during the G20, our president, Ursula von der Leyen, announced a global initiative to help create an enabling environment for local pharmaceutical and health technology manufacturing in Africa, and help tackle barriers on both supply and demand sides. This initiative is backed by 1 billion euros from the EU budget and from the European Development Banks. The African market for medicines and vaccines is growing with its population, obviously. And there is a very high level political interest in local pharmaceutical manufacturing due to COVID-19 pandemic and the launch of the African Continental Free Trade Agreement. The COVID-19 pandemic has created a window of opportunity for development partners at country level to provide more coherent and coordinated support towards identifying opportunities and promoting local production of vaccines, medicines, and health technology products. Vaccines are essential public health tools for combating the spread of diseases. As part of our Team Europe initiatives, and following consultation between the EU and Bulgaria, the EU and the government of Bulgaria are jointly undertaking an action to support the local production of vaccines readiness in Nigeria. Working with NIPRID and as part of the TI MAV Plus, which means Manufacture and Vaccine Plus, this project seeks to complement government efforts to bridge the gap between research and industry in the pharmaceutical sector. The objective of MAV Plus is to increase equitable access to safe, effective, quality, and affordable essential vaccines, medicines, and health technology for all Africans in line with SDG 3.8. The expected results of the broader policy framework for Team Europe and MAV Plus are being pursued through a series of integrated action at country level. And indeed, let me add here that MAV Plus initiative is also part of our global gateway strategy. And global gateway strategy is aiming at progressing together, of course. And the MAV Plus initiative is going to be part of the global gateway strategy, and it will be one of our global gateway flagships for 2024. Coming back to this workshop brings us together as relevant stakeholders in the vaccine value chain to contribute to contextual strategies to achieve sustainable local production of vaccines in Nigeria. We hope that this project will produce a validated and costed national plan and roadmap for vaccine research and development and local production in Nigeria, owned by Nigeria. Finally, let me thank the Bulgarian government again, and most especially the Ambassador Janko Yordanov for their commitment and great Team Europe spirit. I also thank the federal government of Nigeria and of course all participants here today for supporting the development of this national plan and roadmap. This is just a beginning for us, the EU delegation in Nigeria and the EU at large. Thank you all. I sincerely hope this webinar will spark the beginning of improvement in local vaccine research and development and local production in Nigeria. Thank you all.
Thank you very much. Thank you very much, Your Excellency, ably represented by Leila Ben Amor Mathieu, the head of the section Human Development. We thank you for that very special remarks from Her Excellency, Ambassador Samuela Isopi. On this very, very good note, it is my singular honor this morning to bring on board a special message from the Special Advisor on Health to the President of the Federal Republic of Nigeria. We have on board this morning Dr. Salman Ibrahim Anas. Dr. Salman Ibrahim Anas is a public health physician with over 30 years worth of experience in public health program at both national and international levels. She is a fellow of the National Postgraduate Medical College and a member of the West African College of Physicians. Dr. Salman also served as Director, Head of Hospital Services, the Federal Ministry of Health, where she was saddled with the responsibility of coordinating the affairs of our tertiary and specialist hospital. It is my singular honor once again this morning to invite for a special message, his special advisor on health, the President of the Federal Republic of Nigeria, Dr. Salma Ibrahim Anas. Over to you, ma'am. You have the floor. You have the floor, ma'am. Okay, while we are waiting patiently for the special advisor on health to the President of the Federal Republic of Nigeria, I would like us to take some goodwill messages from our partners who have been supporting this great initiative. They've worked very closely with the NIPRID over the years. And of course, we have seen some of this transformation in drug development in the country. This morning, we have some partners, WHO, and also National Primary Healthcare Development Agency, an agency within the federal government, Ministry of Health, and NAFDAC. Please, can we just take some goodwill messages from the partners this morning? We'd like to take the first goodwill message from WHO, the World Health Organization. We have the representative around here to please, as a goodwill message. Okay, do we have any other ones around National Primary Care Development Agency? We'd like to take a goodwill message from them also, if they are around with us this morning. The representative, please, you can kindly unmute. You can kindly unmute if you are around. Then NAFDAC, NIMA, PMG, MA. Any of our partners that are around, please can kindly unmute while they give us a goodwill message. For this great initiative, expediting local vaccine manufacturing in Nigeria, the challenges, opportunities, and the prospects. Please, you have the floor wherever you are. If you are on this call, please kindly unmute while you take your goodwill message. Any of the partners that are around. The floor is yours now. Thank you. Okay, if we're not having any yet around now, I think we can move on to the presentations, technical sections, where we take the goodwill message as we continue in the program. As I said earlier, we want to keep to time. We want to be sure that we follow up with the time. But before we take the technical sections, I can see on the call this morning, one of our esteemed guests, one of us, particularly the Director, Health Planning and Research, a well-known public health specialist, who is also on this call. It's my pleasure this morning also to welcome Dr. Ngozi Azodo, who also will give us a goodwill message from the Federal Ministry of Health. The floor is yours, ma'am. Over to you. Nice to see you, ma'am. Dr. Azodo, you can please unmute.
Conversation.
Dr. Azodo. Dr. Azodo, I hope you are with us shortly. Okay. Okay. I'm not sure if we can hear her clearly. While we just while waiting to get a back call, we would like to also invite Dr. Hamed Yakasai, who is also around on call this morning on this very epoch-making event, as he gives us a short goodwill message. Dr. Yakasai is the former president of PSN. Please, you are warmly welcomed. Kindly unmute as you give us a goodwill message. Over
Thank
to
you, moderator. Yes.
Thank you very much, Dr. Yakasai. We can hear you clearly.
Really gladden my heart to see this conversation. This is something that has been dear to my heart.
Hello, good morning. I don't know if you can hear me. Good morning.
Dr. Yakasai, I think your connection is not too. Dr. Zodo, you can hold on. Dr. Yakasai is on. I hear him clearly. We're not getting him clearly.
Let's see. Oh, it's static. Hello.
Hello, please go ahead. Go ahead, please.
It's okay. Thank you very much. So it is timely. I'm so happy that we're talking about it now, and take me as one of the ambassadors of promoting of vaccines production in Nigeria. Yes, during my presidency as president of Pharmaceutical Society of Nigeria, I tried to work with Ministry of Health, National Primary Healthcare Board, and all the stakeholders. I know I can remember we had a stakeholders meeting, and we all agree that we must come back to what we used to do. You can remember Yaba, we had a very good plant where we are producing yellow fever and so on. I'm so happy private sector has joined the dream of producing vaccines in Nigeria, but I don't know why up till now we have not taken off. Some of the Indian companies I discussed with them, they are seriously frustrated that we have been talking, no action. So I hope this time around, we're going to really take off and start something. So I can tell you that I'm ready to be part of this crusade. I'm ready to see how to convince some group of stakeholders, investors, to really invest into this initiative. So I want to congratulate NIFRID for organizing this. I want to congratulate Bulgarian ambassador, who is so passionate about this. And I personally will work with him to see how we can work together, even if they have a company that is producing vaccines locally in Bulgaria. I can tell you that I have some people who are really interested. They can join hand with Bulgarian companies, even though I know they have state companies, but it doesn't matter. We can work out the agreement and work together. Thank you very much. Congratulations. Count on my support.
Thank you very much, Dr. Hamed Yakasai, the former president, PSN. We appreciate your goodwill message. We'd like to take Dr. Ngozi Azodo, who is back now. Dr. Azodo, please, over to you. The floor is yours. Dr. Azodo, you have the floor now. Dr. Azodo, okay. I think she's off the line now. While we take more goodwill messages, if there are any still on the call this morning, WHO, out of our partners, would like to hear from you. We'd like to hear from National Primary Care Development Agency, NAFDAC. If they're available, please, you can unmute and just give us a goodwill message briefly before we move on to the technical section. I don't know if Dr. Azodo is back. She's not back. Now we can take more goodwill messages from those who are available. Once again, we want to welcome you all again to this epoch-making event. Just as Dr. Hamed Yakasai said, this is very fascinating and very impressive. And this is one of the the way to go. We have been looking into this initiative for a very long time. As we said, this is going to complement the National Policy 2021 of the federal government. I think it will be good for us also to note that if you have questions, please, you can put them on the chat box. Please kindly put your questions on the chat box as we proceed with this very, very special webinar. You are allowed to put in your questions on the chat box, please. Also, we also would like to inform you that please you are expected to unmute. One of the housekeeping rules, you mute yourself until you are asked to unmute. Please kindly take note of all of this. While we proceed in this epoch-making event, it's my singular honor once again to welcome you all on board again. Please, while we moved on, I think it's necessary for us to take the policy statement to be delivered before the technical section. I'm privileged this morning also to bring on board pharmacist Olubunmi Aribiana. He is a Director of Food and Drug Services, Federal Ministry of Health, Nigeria. Pharmacist Olubunmi Aribiana is a seasoned pharmacist and administrator who is the current Director of Food and Drug Services of the Federal Ministry of Health. She was also instrumental in creating the National Health Logistics Management Information Dashboard. Singular honor this morning once again to invite Pharmacist Olubunmi Aribiana as she gives us the policy statement. The floor is yours, ma'am. You're welcome.
Thank you very much, and good morning, everyone. I'm pleased to welcome you all to this event tagged Expediting Local Vaccines Manufacturing in Nigeria, Challenges, Opportunities, and Prospects. It is my pleasure to be here at this very important webinar. This is a platform for relevant key players to share ideas in the area of vaccines, research and development, and manufacturing. First, let me commend the National Institute for Pharmaceutical Research and Development for coming up with this great initiative. And it is important to acknowledge the Bulgarian government and European Union for financially supporting the process. I am excited to see that this is coming at this very critical time. I must say I am impressed by the goal of this webinar, which seeks to bring relevant stakeholders together for the purpose of developing contextual strategies to achieve sustainable local production of vaccines, as well as galvanize support for research and development activities in this area. I am confident that this approach will provide solution to the current situation. I must say I am impressed. Although COVID-19 must have subsided, but the lessons learned are still fresh, including in the area of vaccines, particularly vaccines nationalization that occurred due to lack of sufficient quantity. The COVID-19 pandemic disrupted economies, claimed numerous lives. This emphasizes the need for effective prevention and control for effective disease management. The benefit of vaccination transcend individuals' protection and contribute to the concept of health immunity, a phenomenon whereby the vaccination of a significant fraction of the population indirectly protects vulnerable individuals who have not been vaccinated. Based on the forecast and estimate from statistics derived from the United Nations, Nigeria's population is expected to have reached 264 million by 2030. This increase in population will heighten the need for more vaccines. Vaccination is key to achieving universal coverage, that we all know, in addition to promoting good public health indicators. Vaccines also prevent the financial burden of treating diseases and save families from high medical costs, thereby maintaining their financial stability. The Nigerian healthcare system currently faces a series of challenges due to the country's heavy reliance on imported vaccines, including supply chain disruptions, and limited capacity to respond swiftly to emerging health threats. The Nigerian government has made significant progress in combating vaccine-preventable diseases through the National Immunization Program and health surveillance systems for emerging epidemic and pandemic diseases. However, one major setback of the immunization drive has been the absence of a need-based vaccine policy that promotes national self-sufficiency regarding the provision of safe and efficacious vaccines and other immunization strategies. The Federal Ministry of Health, through the Department of Food and Drug Services, was able to mobilize relevant stakeholders to develop a national vaccine policy in 2021. The Nigerian vaccine policy addresses the goal and objectives of achieving availability, self-sufficiency, and vaccine security in the country. It is hoped that this development will complement the already existing immunization policy, ensure ownership, and provide the platform for ameliorating of infectious diseases in the country. Efforts made in the past to ensure the production of vaccines in Nigeria battered the vaccine production unit in Yaba, Lagos. The unit produced smallpox, rabies, and yellow fever vaccines for use by Nigerians and other West African countries from 1940 to 1991, after which it became inactive. Nigeria has since relied on UNICEF for vaccine supply. The procurement process is being co-funded by the federal government of Nigeria and Vaccine Alliance Gavi. Nigeria would have transitioned out of Gavi support, but a real negotiation took place to extend the support for a few more years, which calls for action. Setting up a vaccine manufacturing plant requires careful planning, adherence to regulatory guidelines, and investment in infrastructure and equipment. Hence, the need for support from development organizations and donor agencies. Luckily, Nigeria is teamed with experts in various sectors that can guide technical advancement in local vaccine production. Local vaccine manufacturing offers promising opportunities, especially when we consider the African Free Trade Zone Agreement and prospect for Nigeria's healthcare system. It will improve the population's access to vaccines and enhance public health outcomes. It would also provide an opportunity for technological innovation, capacity building, and knowledge exchange, ultimately fostering the growth of the domestic pharmaceutical industry and stimulating overall economic development. It is therefore imperative for Nigeria to urgently commence the manufacture of vaccines for the use of her citizens. As we move forward, let us remember the importance of collaboration and cooperation. We must leverage the collective contributions and expertise of all stakeholders involved to ensure the success of this remarkable endeavor. NIPRID is statutorily charged with the responsibility of research and development of drugs, vaccines, phytomedicines, commodities, and diagnostics aimed at improving sustainable access to safe, affordable, and high-quality healthcare. The agency has continued to set the pace, indeed a pace setter, for responsive innovativeness in our nation's research and development drive. In line with the mandate of NIPRID, I am fully aware the Institute made considerable contributions to the response of COVID-19 pandemic, both in country and globally. Some of NIPRID's contributions, which include verification of cure claims of herbal products, production of standardized sanitizers, development of phytomedicines against COVID-19, amongst other interventions, went a long way in ameliorating the pandemic in Nigeria. NIPRID being the lead agency for vaccines, research and development, I want to assure that the Department of Food and Drug Services will continue to support the Institute's activities in this area. Finally, I wish to once more express my gratitude to the Bulgarian government and European Union for this intervention. I also want to thank the Director General, the able, the capable Dr. Obi Adigwe for concepting this project. This will provide an opportunity for Nigeria to quickly move from the policy stage to practice and ensure a steady supply of high quality, safe, affordable, and efficacious vaccines. Thank you all and welcome.
Thank you very much, Pharmacist Olubumi Arabian. We appreciate this wonderful talk on policy statement. She has emphasized to us that the driving force of the Nigeria vaccine policy is to encourage local production of vaccines and to ensure self-sufficiency in vaccines availability, which will further boost the already existing national immunization policy. We want to thank you once again for that brilliant presentation. Please, I'd like to quickly invite just a goodwill message from Dr. Azodo before we will take the special advisor on the heart, who is also online with us on this call. Just 2 minutes, Dr. Azodo, 2 minutes on the goodwill message before we invite the special advisor on the heart, Dr. Salman Ibrahim Anas, for the special message. Dr. Azodo, 2 minutes. Thank you.
Very good morning.
Good morning.
I believe you can hear me now.
Please go ahead, we can hear you. Thank you.
Okay, well, mine is just a goodwill message. And I was saying before the line went off, I want to appreciate everyone, especially the organizers of this very important meeting. Having lived through the COVID season, we realized that there was a critical need for local vaccine manufacturing. We cannot achieve our own health security without that. So having this meeting is so key. Now the Federal Ministry of Health has done a lot, has started the process of trying to empower the system to ensure that we are on the right track in this journey to local vaccine manufacturing. My colleague and my sister, Pharmacist Arabiana, has already outlined a lot that has been done. So I'm not going to underscore what she has said and repeat what she has said, but just to say that, yes, local vaccine manufacturing is very key to our health security objectives and targets in Nigeria. Also to emphasize the fact that there are a number of ecosystems that need to be in place, the research ecosystem, the capacity to regulate and all of that are supposed to be in the system, and those have been established or are being established. For instance, we're looking at re-establishing the research ecosystem. What exactly do we need? Currently, the DHPRS, or the Federal Ministry of Health, the DHPRS, is mapping all of that, looking at what is the relevant research ecosystem that needs to be in place. Thereafter, we also need to identify what capacity, what is the capacity gap, and then what can we do to fill those capacity gaps. But we're not going to line it up and do this one after the other. So a number of other things are also ongoing. The Federal Ministry of Health through NAFDAC has also achieved level 3 maturity, which is essential, but not enough. So they're also working towards going to the next level. We have looked at various partnerships and tried to mobilize partnership towards this vaccine manufacturer, because it's not something either the government or the private sector can do. Vaccines are not products that you produce and put on the shelf. They are products that, you know, the profit margin is so small that the private sector needs to be not just encouraged, but supported, you know, by government to ensure that they are able to do that. So there are issues around advanced market guarantees and all that for the private sector to be able to manufacture. We as Nigerians must be mindful, and all of us here are experts. We must be mindful when we attend functions and make commitment that the love other people show us is because of our population. We're a big market. They want to take this market. And once they get this market, our own manufacturers will not have anywhere to sell, or they'll be more challenged. So we also must begin to look at how can we, you know, encourage our people, support our people to create these opportunities. First, we manufacture, we have health security. Secondly, it creates jobs for our people. It improves our economy. It's just a whole gamut of activities. So we recognize that this is so key. So on this note, I want to thank the organizers of this important meeting. I want to encourage further action. I also want to say that we are committed as the Federal Ministry of Health to support this process and take it further. And we're available and willing, available as per this is our responsibility as the health sector, but also available with all our technical skills and to create the necessary partnership, to ensure that this thing goes forward. Pharmacist Aribiane is at the forefront of this work, and all the other partnerships that are key will also be established. So we are waiting for the outcome of this very important meeting. Thank you very much.
Thank you very much.
Bless you.
Thank you, Dr. Ngozi. Thank you very much. Thank you for all you do at the Federal Ministry of Health. We appreciate you. It's my privilege to also, thank you very much, to welcome our special advisor on health to the President of the Federal Republic of Nigeria, Dr. Samuel Ibrahim Anas, for a special message. Over to you, Mark. The floor is yours. I would like you to just help us out in the next 3 minutes. Thank you. The floor is yours, Mark.
Thank you very much.
You're welcome.
Thank you. And I sincerely apologize for the delay. I think I had some misinformation and other competing issues, so please accept my apology. The Director General, National Institute of Pharmaceutical Research, NIPRID, Dr. Obi Odigbe, our partners that are here with us today, representative of the Federal Ministry of Health, distinguished participants, good morning to you all. I welcome everyone to the webinar workshop on expediting local vaccines manufacturing in Nigeria, challenges, opportunities, and prospects. On behalf of the organizers, you are all welcome. And I'm also speaking on behalf of the federal government of Nigeria. We have made several attempts in the past to ensure that we domesticate local vaccine production in Nigeria, not just vaccine, but also medicines and other consumables, medical consumables in the countries. As said by the previous speakers, the COVID pandemic experience has given us opportunities also to deep dive and understand the weaknesses that we have in the health systems, and also to renew our efforts and commitment on the great need to domesticate and ensure that we have local manufacturing of vaccines in Nigeria, because the market is in Nigeria, and we can also capture the African markets. So this is coming very timely, especially now at the critical stage that we are of the transition. The new government under the leadership of President Bola Ahmed Tinubu is committed to strengthen and ensure local manufacture of vaccines, medicines, consumables, and all medical products, to reverse it from 60 in Nigeria as what we have today. 60% of our local productions and consumables are imported. So the effort and the commitment is to see that we reverse that. So this is coming very timely as it aligns fully with the vision of the administration of President Bola Ahmed Tinubu, and is one of the critical pillars for the development of the health sector, of the renewed hope for Nigerians for the health sector development and delivery of healthcare services, quality healthcare services to the teeming populations of Nigerians, particularly the vulnerable group, including women and children. So I want to assure you that we are committed and we are interested and very keen to the outcome of the project that will set the agenda for the local production of sustainable vaccine research and development in Nigeria. I want to sincerely appreciate all of you, particularly the Director General, Dr. Obi, for the efforts you have put in place and for driving the process. And I pray that Almighty God will continue to guide you to drive it to continue to import products from abroad, but we rely on our local production. I also want to appreciate our partners, whom without their contributions and efforts, this will not happen. I want to extend appreciation to the European Union and also to the Bulgarian government for all their support to local production. But we must also recognize the efforts of our institutions, particularly the universities, that one of their pillars is to conduct research. This administration is fully committed to bring back and ensure that grants are available, funding are also available to our research institutions, because this is one of their pillars, in addition to training of health workers and also delivery of quality healthcare services. Research we are there to ensure that it happens. And that is what the renewed hope is aimed to achieve in Nigeria. Without saying so much, we look forward to the outcome of this workshop. And we look forward to working with you in partnership to ensure that Nigeria achieves sustainable vaccine production. Thank you all, and wishing you all the very best and success as you go ahead with this workshop. Thank you.
Thank you very much, ma'am, the Special Advisor on Health to the President of the Federal Republic of Nigeria, Dr. Salman Ibrahim Anas. We appreciate you for the reassurance again from the federal government. The Nigerian government is highly committed to this agenda of local vaccine production, because it is a pillar in the current government's commitment. Thank you for this reassurance again. We appreciate you for coming on board. We're grateful. Thank you. Distinguished ladies and gentlemen, we are now about to move into the technical sections where we want to go into the nitty-gritty of what we have today, particularly looking in depth into local vaccine production, manufacturing in Nigeria, the challenges, opportunities, and the prospects. It's my singular honor to bring on board our first speaker, Dr. Kenneth Hagu, who will be speaking to us on innovative solutions to achieve sustainable local production of vaccines in Nigeria. Dr. Kenneth Hagu has 23 years of professional experience as a public health specialist. He's an expert in strategy, planning and development, program management, health and pharmaceutical system strengthening, and of course, a renowned scientist. He is also a fellow of the West African Postgraduate College of Pharmacy. It's my pleasure this morning to bring on board, as he takes us with the first talk, innovative solutions to achieve sustainable local production of vaccines in Nigeria. Dr. Kenneth Hagu, over to you.
Thank you very much, the Prof. Please permit me to stand on the existing protocol. Let me share my slide first.
Yes, you can go ahead.
Just a minute.
You have 10 minutes. Thank you. You're behind time. Thank you.
Okay. Please, can the media help me share it? I'm having difficulty trying to share it here.
Media, can you help us out, please? Thank you. Dr. Kenneth Hagu holds a Bachelor of Pharmacy, degrees in Public Health. We can see your slide now, Dr. Hagu, please. You can go ahead.
Okay, thank you very much. Let me start by saying that a lot has been said with respect to the subject matter. And I want to start by saying that the picture that we want to see is Nigerian producing vaccines for Nigerians. Please, can you go to the next one? And African producing vaccines for Africa. And I want us to have this statement in perspective that says that local vaccines production will better fight endemic diseases and save more lives through increasing timely access to priority to priority vaccines, alleviating risks of import-related supply chain disruptions, and improve vaccine supply security, and also contribute to global pandemic preparedness and substantially contribute to boosting the socioeconomic development of the country and the region. I want us to put this statement into perspective and think about it, what we stand to gain if we succeed in producing the vaccines that we need. And I want to ask these key questions, very key questions. Picture African vaccinating Africa. We ask ourselves, is it necessary? Yes, it's necessary, but is it achievable? These are questions that we need to look at. Nigerian vaccinating Nigeria is very necessary, but is it achievable? If yes, what are we going to do to achieve this? These are questions that we need to ask ourselves, and I'm only going to be stimulating this discussion, and I know that all of us will be able to contribute to coming up with these solutions that will solve the problem, because we need all hands on deck to having what we need to do to have Nigeria produce these vaccines. So a bit of a little background. A lot has been said about the COVID-19 pandemic, what it made us realize that the vaccine plays a key role in controlling infectious diseases, and that we are over-dependent. In fact, Nigeria is 100% dependent on import for vaccines. And then the one I consider the immorality, the unequal access, where some human lives are more, looks as if they are more important than the others. Unequal access and our vulnerability to vaccine crisis during health emergencies. This was very pronounced during COVID-19 pandemic. And then we have little or no local production of vaccines in many parts of the region. This all resulted to this renewed interest of this conversation we're having in vaccine research and development, and expansion along the value chain from drug substance manufacturing and all that, despite the fact that vaccine innovation is costly and highly complex. Next slide, please. So let's look at the Nigerian situation. Our Director of Food and Drugs Services said a lot about it and very passionate about it. We look at local production of vaccines. In the 90s, 1940 to 1991, Nigeria produced smallpox vaccine, rabies vaccine, yellow fever, but it happened in Nigeria at the Yaba production unit in Lagos, Nigeria. But it stopped production since 1991. So what has happened between 1991 and to date is total importation of the vaccines needs of the country. And then the funding for vaccine production has always been from that time by co-financing by the federal government of Nigeria and Gavi. And this is going to end in 2028. After the renegotiation, like our Director of Pharmaceutical Services said, it's going to end in 2028. What will be the fate of Nigeria? So that underscores the importance of this discussion that we're having at the moment. And then let's look at the African situation. Africa has 17% of the world population, but unfortunately, Africa has 58% of vaccine preventable disease-related deaths in children under 5. But it only produces 1% of its routine vaccines and 0.1% of global vaccines need. The same Gavi UNICEF supports over 40 countries in Africa, financing, procuring the 2/3 of African total market value in terms of the vaccines needs. And at the moment, we have about 12 vaccine producing facilities either in operation or still in the pipeline across 6 African countries. And unfortunately, Nigeria is not one of the countries that is being mentioned. We have Algeria, Egypt, Morocco, Rwanda, Senegal, and South Africa. So the African CDC has this ambitious target made in 2021 that Africa should be able to manufacture 60% of the African routine vaccine needs by 2040. Nigeria has a big role to play in achieving this, and the time to start is now. Next, please. Next slide, please. So these are few of the key barriers to vaccine production in Africa and also in Nigeria. But notwithstanding, it's something that has to be done. The high upfront cost of vaccines research and development, this has also been talked about. Limited or no access to affordable and reasonable funding. When we say the affordable and reasonable fundings, we know in research and development, the issues of patent, intellectual property rights, and all that. We also will limit the further duplication of the product and all that. We have also challenges regarding to access to licensing.
Thank you. Go ahead, please. You have 3 minutes. Thank you.
Okay. We also have challenges regarding to access to in-licensing or joint venture partnerships. Lack of strong commercial or business case often limit investment and stall research and development. Lack of supportive infrastructure for regulatory compliance and weak regulatory system, insufficient capacity to produce vaccines. As a result, poor technical support and limited expertise. And also the poor political will and what I call the misdirection or mismanagement of available resources or the funds that we have. So these are part of the barriers that, and then it's not exhaustive. There are many other barriers that we have, but which in the course of this conversation, we will all, see that. What way forwards do we have? This is in by no means exhaustive. So we need to be able to map, mobilize, and engage Nigerian stakeholders, experts, scientists for these tasks ahead. We also need to develop local capacity, the talent and skills, infrastructure for vaccines research and development and production. The government of Nigeria needs to also reprioritize and increase investment in this area. And part of what needs to be done is securing the political will, creating enabling environment and infrastructure, establish a dedicated and sustainable vaccine security fund at all levels, and provide incentive to attract foreign direct investment, such as tax incentive, waivers, and strengthen existing legislation, the regulatory agencies that we have, and also support the establishment of modular and flexible manufacturing capacity for new plants. This will help in terms of moving forward, and implement the joint ventures partnership between government, universities, and all relevant stakeholders, including the private sector. This is important with respect to business case development, because private sector is profit driven. So we need to be able to make a case that make them attractive for them to put their money in this area. Licensing agreements, reigniting the vaccine manufacturing hubs. This was established some time ago, and we need to make it functional and then move from theory to practice, having a kind of a supportive collaboration. We might also need to collaborate with the developing countries' vaccine manufacturing network in terms of sharing research, development, manufacturing technology, and also supply of vaccines. Next. So the issues, like I said earlier, the issues around intellectual property rights, the foreign support versus a waiver to allow for the local manufacturers for vaccine duplication and speed of vaccine. This is important. That brings us to the issue of advanced purchase agreement. This is something that we need to look at. Like I said, this is something that private sector we know is profit driven, or other investors is also, want to know what is in it for them. This needs to be addressed in advance. We could also start with vaccines with high supply constraints and low manufacturing complexities, and support the WHO vaccine pre-qualification for quality, safety, and effectiveness. This provides opportunity for increased sales and market access for locally produced vaccines. There are a lot of other recommendations that we have in the national vaccine policy, which I believe that will also help in entrenching and achieving sustainable local production of vaccines. So in conclusion, I would say African vaccinating Africa is necessary, and I believe is achievable. And Nigeria can vaccinate Nigeria by producing all the vaccines the vaccine the country needs. All stakeholders' commitment and sustained joint actions are urgently needed to make this happen. This is a call to action for all, and I say thank you.
Thank you very much, Dr. Agu. Thank you for your brilliant presentation. Nigeria, vaccinating Nigeria is necessary and it's achievable. He has also emphasized that there are three basic sides for us to look into critically: industrial development, demand market shaping and trade facilitation, enabling environment, regulatory strengthening, technology transfer, access to finance and R&D. All these he has been able to present to us. And of course, the floor is open for us to please put in our questions on the chat box. Please, if you have questions, kindly begin to bring in your questions in the chat box, and then we'll go through them at the time for questions and answers. On this note, again, I want to thank Dr. Kenneth Agu for his presentation. Our time, we're running with time, so we need to move on to the next presenter, who will be presenting to us from policy to practice, assessing implementation readiness, local vaccines, R&D, and manufacturing. Of course, who will be doing this is no other person than Dr. Olajide Adebola. Dr. Olajide Joseph Adebola is a global digital health system expert. His career in e-health, digital health, public health is over 19 years. They focus on research and evaluation in digital health, telemedicine, user-centered design, and health informatics. He served as National Digital Health Consultant at the World Health Organization Nigeria office to support the Federal Ministry of Health. It's my pleasure this morning to bring on board Dr. Olajide Joseph Adebola for your presentation. The floor is yours.
Good everyone. I have followed
Adebola, you have 2 minutes. Thank you.
Thank you very much, Mr. Moderator, for the good job you are doing. A lot has been said by earlier speakers in their introductory remarks and goodwill, and there's no doubt to achieve the utmost purpose and the goals and objectives of the National Vaccination Policy of the year 2021 in Nigeria, which is to improve access, self-sufficiency, and vaccine security, we must produce locally. And so there's a need to enable this production locally. And the production will be incomplete or will not be possible and adequate if there are no enabling environments, which is what the policy does. I'm privileged to serve as a project coordinator for the management structure of this project. And I want to use this opportunity to thank the European Union delegation to Nigeria and ECOWAS, the Embassy of Bulgaria in Nigeria, the National Institute for Pharmaceutical Research and Development, as well as the technical assistance team at NIPRI, all working together to manage this project. From policy to practice. Quickly, I will just talk around what the stakeholders should be expecting in the next few weeks as we look forward to ensure that we all have the national destiny of vaccine manufacturing as well as research and development in our hands as stakeholders in Nigeria. A quick policy to practice stepwise approach, looking at our readiness, how fully prepared are we? What are the gaps and the challenges that exist? I'll be sharing how we're going to be doing that together. And then eventually, we'll have that policy, a national plan or roadmap that actually shows the directions, the intentions of the federal government, the stakeholders, and the people of Nigeria to ensure increase in access to vaccine as well as research and development in Nigeria. It doesn't matter which one comes first, roadmap, plan, strategy, all are referring to policy. So either the chicken or the egg, but most important, to enable local research and development, as well as the practice, which is the actual implementation and application of those policies to initiate local production of vaccines to increase the numbers of research outputs that will influence further development from various labs and from various hubs that will be mapped out in the plan. It's important to have a well-grounded policy development process that is defensible to critics anywhere, and also to attract more partnerships, both from the private sector as well as our development partners. So using policy process development, I also want to acknowledge, without any conflict of interest, those icons from the CDC policy process. We intend to identify the current challenges in the course of this workshop. And also, if you check the chat box, a link for a poll, some set of questions that will help us to understand the problem and the root cause much more better as regarding local research and development in vaccines ecosystem in Nigeria, as well as manufacturing. So once these are clearly highlighted, itemized by stakeholders, not Dr. Adebola or any of those I've listed in the management structure for this process, will conduct an operational research. And this will help us to draw strategic context from the conclusions and inferences from those studies. And that all will lead to the validated and costed national plan for local vaccine research, development, and production. Of course, it is expected that a series of meetings will still take place where we'll be inviting you virtually as well as face-to-face for the process in itself to analyze the options we have. Quite a number of challenges has been enumerated by the previous speaker. And so with that, we can draw up strategic recommendations that will populate our dream of having a validated and costed national plan for local vaccine research and development and production in Nigeria. So eventually, when we have this plan will be iteratively developed. I've talked about the management of this process, and it's largely dependent on stakeholders. And that's why we're engaging all stakeholders as much as possible with the first activities in this project to establish the strategic context. We'll also be learning from trends and experiences, not just in our local environment, in the region, as well as other clients from Europe to Asia and the Americas who have achieved critical milestones and turnarounds from turning research outputs into innovation and development to boost local vaccine production. With this, we create our first initial draft of the strategy. We'll be sharing with you at that stage as stakeholders for your input, and those inputs will be collected together for a final draft through components that we have identified that is critical to be enabled by government policy, and then the information on the entire vaccine value chain from manufacturing, research from the lab, distribution, logistics, access, vaccine knowledge, and competencies. How many minutes more, sir?
You have just 4 minutes. Thank you.
And then with that, at the final workshop, we'll define the plan based on the steps. So it's not enough to have this plan. We don't want it archived electronically or physically in hard copies at the end of its production, which we hope to achieve by December 2023. And we want to start seeing, hopefully and optimistically, that by the first quarter or end of first quarter 2024, we should start implementation activities. Definitely, if you go through the process to enact it to become the policy for vaccine production and research initiation in Nigeria. This will take place through the approval by the National Council on Health, the highest organ that implements our health policy. This is very critical, policy to practice now. So whether it's the policy that comes first or the practice that influences the policy, both halves have a feedback mechanism and a two-way communication. So we are starting with a policy. We already have a vaccination plan. I want to ensure that there's adequate access and local production so that our various hubs for storage are well equipped to meet with any epidemic or future pandemic. So the implementation is very critical for all stakeholders, and this will translate our intent in the policy to practice. And the utmost high-level impact of this is initiating local vaccines production in Nigeria. We already have some initiative, and then we hope with this plan, national plan, more stakeholders, like the PGR said, 3-5 more production sites mapped out for local vaccine production. So we have brought you together from various diverse backgrounds. You have different roles you're already playing. Some will get additional roles. We'll be reaching out to you individually in the course of our operational research for our qualitative and quantitative studies. This is very important, such that at the end of the day, the plan will be evidence-based, politically informed, and honed by all and sundry in the sectors and partners of Nigeria in progress in the health sector. So very critical is that we need to understand the wait for and things that are against local vaccine research and development in Nigeria. Of course, capacity gaps has been mentioned earlier by one of the speakers too. And in doing that, in the course of this project, we will also be addressing capacity gaps and conduct also a training workshop for identified stakeholders with roles for research capacity development in vaccine ecosystem in Nigeria. And having said that, it's very important that it not be possible without your contribution. Thank you. Thank you very much. You can drop your questions and answers in the chat box. This is the local vaccine research and development readiness support project and production in Nigeria.
Thank you very much, Dr. Debola Olajide Joseph. He is the project coordinator, support to local production of vaccines readiness in Nigeria. We thank you again for that very brilliant presentation. Thank you for the insight given to us on all the needed plans which are on ground for us to begin to run with this policy to practice, particularly at this time when we need vaccines in our country, locally developed vaccines. On this note, again, I want to thank you for that presentation. Please, we request that all our audience should please kindly put your questions on the chat box, and the questions will be attended to at the appropriate time. Please permit me at this juncture to welcome also the top, but not the least, the last presenter for this webinar today. He will be speaking on sustainable funding and financing models for vaccines, R&D, and local manufacturing. It's my pleasure this morning to bring on board Dr. Olumide Okunola, who is a senior health specialist at the World Bank. He works on health system strengthening and private sector participation in health systems. He has worked extensively in the conceptualization, design, and implementation of several pro-poor risk pooling schemes in Nigeria. Olumide contributed significantly to the design of one of the largest health financing reforms in Nigeria, that is the Basic Healthcare Provision Fund. It's my pleasure once again as I bring on board Dr. Olumide Okunola. The floor is yours, Dr. Okunola. You have 10 minutes. Thank you.
Thank you very much. Just to confirm that you can see my screen and
your screen is fine. You can, thank you. Okay, now you can go ahead. Thank you, Dr.
Okay, I'm not going to waste too much time. I'm just going to rush through this slides just to mention that I'd like to acknowledge some of the slides are from the work already done by the African CDC, trying to shape the vaccines market across the continent, and also partners like the Clinton Health Access Initiative through the PATH program. So we won't be reinvesting the wheel. My presentation will simply be in two parts. What's the investment case for vaccines like, and where does Nigeria sit in all of that? I want to assume that this is a family meeting and we can probably tell ourselves some hard truths. I will say it as it is. I have written on this subject matter sometime before. I will urge colleagues to look at that publication. However, we'll just go into it. Several speakers on this call have probably alluded to some of the drivers in terms of what makes the vaccine market a good place to invest. But beyond all of this, I think mine will just be even saying what COVID has shown us shows that there is an investment case from both a return perspective and a security perspective. But because you have built it does not mean that people will come. So my first message, regardless of whatever I say on this presentation, is that the fact that you have vaccine manufacturing capabilities does not mean that you will make a profit from it. So there needs to be a strategic, intentional, deliberate attempt to ensure that this is done right. And I say this, it's either the African Union through its leaders come together and say, which of our countries will have this plant? Otherwise, all countries that can put up a plant should not do so. So this needs to be addressed at the highest political level, but also at the country level. And Nigeria has a unique case to do this. Just to mention that, of course, if you look at the countries with some of the highest fertility rates, which also shows why the return for the market on the African continent is high. Several African continents, the fertility rate is still high, so which means that we will still need a lot of vaccine preventable, vaccines for childhood immunizations, amongst other things. And several of those countries where that population growth rate is high are on the continent. If you translate that into numbers, like most financiers would ask, this shows that the vaccine demand is going to increase by almost 2%. If you translate that 2% into what the volumes are, that's what it is on the slides now, or almost 2 billion doses, and in terms of market size, close to 5 billion. So the investment case is solid, is there, but you need now to make a strategic decision. I missed one very quick point. I'll just very quickly go back. I know that the speakers asked me to talk about local vaccine manufacturing in Nigeria, sustainable financing. I added this, and I think it's important. That would be my second point. So I changed it to comprehensive vaccine manufacturing in Nigeria, because Nigeria needs to go beyond field and finish. And I would explain this shortly. So the investment case is solid. It's in the black. The volumes are high. The expected returns could be high, but it's not a sufficient condition. One of those reasons is Gavi. So several countries on the continent are supported by Gavi, which means that the pricing is dependent on what is Gavi buying, how much are they buying, which countries are they supporting. So if you set up a manufacturing plant and you are not on the Gavi list, or your vaccines are not being procured by Gavi, and you can't compete with those that Gavi is buying from, then you will be the ones to just use your vaccines alone. However, saying that also shows that a lot of countries on the continent are also transitioning out of Gavi. A third point to note under the Gavi discussion is that also other new vaccines are coming on stream. So this is a very uncertain market. The pricing is, like someone had mentioned, the margins are extremely thin, ultra thin, but all of this needs to go into the business case. So it's not just setting up a plan, you need to see what the environment is saying. And the Gavi analysis is very critical. A fun fact here is, if you look at the yellow fever vaccine here, which in fact someone mentioned on this call, Nigeria used to make until 1991. And I do hope Professor Tomori is on this call, and it will be useful for the moderator to ask for his reflections during question and answer. Look at what countries that are not supported by Gavi are paying for yellow fever vaccine, which Nigeria used to manufacture. But big point is that Gavi has to go into your investment case in terms of the volumes, in terms of the margins, in terms of the mix of vaccines being. Again, still on Gavi, but not Gavi in itself. This was just simply to show the countries that are currently Gavi supported, not Gavi supported. But I want to show Nigeria within this mix. That will be my third point. So, ladies and gentlemen, brothers and sisters, Professor Adigwe and colleagues, if you set up a plant in Africa or on the continent, and Nigeria is not going to buy from you, you probably will not make a profit. Maybe I should repeat that, Professor Kolawole, so that we are clear.
Yeah.
Africa is setting up plants to sell to Nigeria, because it is when you sell to Nigeria that you make a profit. And I do hope that is understood by everybody. And most countries, unfortunately, there are about 3 or 4 plants now that are well ahead of Nigeria. And unless the processes described by Dr. Salma, Dr. Debola, Professor Digwe, if it does not happen in the next couple of months, then we will lose out. These are the kind of numbers that Nigeria is producing, that Nigeria requires. If Nigeria sets up a plant, you can pretty much say that most other plants will not be viable. But is Nigeria ready? Of all the countries that are ready, Nigeria is not necessarily part of the top 3. Again, where are the current vaccines coming from? Mostly from outside of the continent. Just to mention that for vaccine manufacturing, you either manufacture end to end, or you fill and finish. I'm saying here now that currently the continent almost have more than enough capacity for fill and finish. And a personal perspective from me is that a fill and finish strategy, ladies and gentlemen, might not be Nigeria's best route to the market. Let's go to ground zero and build up. That's the only way we can be competitive. But that in itself then comes with certain decisions at the highest political level. And I hope Dr. Salma is still on this call. Fill and finish is easier, but if you look at this slide and what is already happening on the continent, this might not be a strategic approach. This is what the landscape says, and I bring the attention to BioVaccines Nigeria Limited, which is the only one here now, which seems to be Nigeria's best bet going forward. So let's look at Nigeria in specific now. But you needed to look at that big African picture to then hone down on what Nigeria should do.
Dr. you have just stepped, maybe concluding.
Okay, let me then show this is the end-to-end for vaccine manufacturing, starting from procurement all the way to shipment and distribution. So in terms of the strategy that I was talking about, then you need to tick all of this box, including procurement of APIs, rather than just focus on fill and finish, which is the pillar 4 here. Doing that means that you are starting from a higher risk end of the investment spectrum. The kind of financing you require here, because it's very risky, is not the kind, it's not cheap, it's not easily available. And a government that wants to do comprehensive manufacturing will then say, look, you know what, where do I, or how do I make up for this kind of risk? And my option will be, I have mapped a number of things across that spectrum. I have the Nigerian Sovereign Investment Authority, which is Nigeria Sovereign Wealth Fund, as a financier to take that early risk. They've done that in other sectors. They need to be part of this conversation. Without R&D, which is NIPRID, working with the universities, you can't have an end-to-end manufacturing. So this is not just about money. All of the players on this map, and I'm sure it's more, which is perhaps is what Dr. Adebola wants to do, everybody needs to come to the table. Without your national regulatory authority, thankfully they have maturity level 3, which is a giant step, but we still need to have the necessary human resources. All of these people need to work together, need to come together to have a comprehensive manufacturer plan. I end with this, Professor Kolawole. So
thank you.
Has a vaccine policy, right? Launched just in 2021. The past administration launched a presidential health sector reform report, which I think, just look at it, had a few elements on vaccine manufacturing. I think we already pretty much know what to do. My last comment is that there needs to be a presidential committee set up to bring all of these people that I mentioned earlier on together and try and fast track whatever BVNL is doing, working as a collective. Otherwise, Nigeria will be late to the party, despite the fact that we have a population that can actually make a viable manufacturing plant in Nigeria. Thank you.
Thank you very much, Dr. Olumide Okunla, Senior Health Specialist, World Bank Group. We thank you for that presentation again, giving us a clear, lucid reasons and areas for sustainable funding and financing models for vaccine R&D and local manufacturing in Nigeria. He has emphasized the fact that the time to begin our local vaccine manufacturing is now. Nigeria and Africa has the capacity to achieve this. And we need all hands on deck collectively to do this. Once again, I want to thank you, Dr. Olumide, for that thought-provoking presentation. Distinguished ladies and gentlemen, the questions have been pouring in the questions and answer section. We can see all your questions, and we really appreciate that you are actually following with us since we began this webinar. Permit me to please recognize the following who has been on this call with us. We have Dr. Ayeke Anthony of World Health Organization is also here on this call. So thank you for being here. And thank you, Dr. Ayeke Anthony, for answering some of the questions already posted in by some of the participants on this call. We also have here this morning also the Vice Chancellor of Chrisland University, Professor Chinedu Abalola. Thank you also for being here also. And we also have with us here the Executive Secretary, Pharmaceutical Manufacturing Group, Mr. Frank Moneme. Thank you also for joining us on this very special occasion today. It's an epoch-making event, actually pioneering the local vaccine production in Nigeria. It's timely, and it's one of the ways to go now. I would like to go straight to the questions and answers. Of course, most of the answers have been provided by most of our distinguished audience who are here on this call. Dr. Anthony Ayeke is with the European Union, not WHO, please. I'm sorry for that. The European Union. Thank you, Dr. Ayeke Anthony. And thank you also for providing some of the answers to some of the questions that have been posted by most of the participants in the platform. Please, because of time constraint, we may not be able to go through all the questions, but I want to assure you all that all the answers to the questions you have placed on the chat box have been answered by our technical team already. But permit me to just take one or few, the ones few that we could just go through, and all others, please, you can kindly, if we cannot take them, there are so many questions on the chat, so please, you can also see answers to the question. One of the questions that have been, Saeed, he talked about, I think that's the only one that I've not been answered is the one from Saeed Abuda, and the question reads, like to directed to the speaker. I don't know who is the speaker, whose question have been directed to. Okay, this is the question from Saeed. Say, what are the options to encourage or garner federal government support on local vaccines production in Nigeria? And emphasize, could it be that the people in charge failed to realize critical need of vaccine in putting preventable disease under control? Also, these are some of those speakers who are actually expected to answer these questions. Please, they will allow you to make one or two clarifications on these questions as I read them out to you. There will also have another question from Anonymous. He said, what are the incentives for local manufacturers to encourage uptake, knowing that market access is key to return on investment? I'm sure that question is directed to Dr. Okunla Olumide. Is the government of Nigeria committed to the advanced procurement agreement? Another question also from Darlington Ugu, saying, are there plans to engage with other vaccine manufacturing institutes, companies in Africa that are currently operational in terms of technology transfer or any other assistance that can expedite this process? Please, our speakers who have taken their presentations should note if these questions are applicable to them, and then I'll just give us just for 1 minute each to answer some of these questions which have not been addressed at the chat box there. And the last one is from Suleiman Surajuddin. What measures are in place to engage the private pharmacy and public hospital and private primary health care facilities for easy availability, accessibility, affordability of locally produced vaccines when the production begins. So please, Dr. Olumide Okola, just 1 minute, and then.
Thank you very much.
Look, thank you.
There's no point buying a car and park it in your garage if you are not going to use it. There's no point having that car and be walking to the market every day. So Nigeria has 49% in BVNL. Nigeria owns a vaccine manufacturing plant. If he doesn't want to use it, that's fine. But if you have a 49% stake, the chairman of BVNL is a nominee of the president of Nigeria. So I don't even have the pathway to even see another manufacturing company. If you now want to bring in other companies, then withdraw from BVNL and then have an open market. That's the way it's done. Why? If you have invested in a plant, it means that you are going to buy from it. It means that whatever that plant, unless you don't want to patronize the company that you have set up, because the message you are sending to the market is, this is my company that I've invested in and I will buy from it. It's a good strategy. There could also be other strategies where you make it an open market, everybody come and develop an innovation, and then that's fine. So government needs to take a strategic decision on BVNL. With the MOU it has an MOU, it's invested in it, and it also has an offtake agreement with the BVNL. So I think we need clarity from the highest political leadership of the country to say, am I using this Rolls Royce or not? Thank you.
Thank you, Dr. Kola. So quickly, Dr. Agu, you have something to also say on the questions. Thank you.
Yeah, thank you very much, Prof. Just to say that this webinar is just one of the series of activities that will culminate into the development of a roadmap that will answer a lot of these questions that is being asked today. So I will just call upon these stakeholders to make themselves available to make contributions into this the final document that will come out of this exercise, which is the roadmap to local production of vaccine in the country. So in that document, the plans will be elucidated and all the necessary activities that needs to happen in terms of the subject matter will all be outlined. So we'll still be calling upon the relevant stakeholders to be part of developing this important document.
Thank you. Thank you very much. Thank you very much, Dr. Agu. Dr. Adebola, you have something to say on these questions? Just 20 seconds if there is for you. If there is none,
well,
okay. Dr.
I think we have achieved the objective of coming together today and listening to stakeholders. The questions that are pouring in are torrential in nature, and it's been difficult here at the back end to keep up attending to them. We will be taking all of those questions into context. We'll be using some of them in our definitions of the problems, as well as methodology for the research. Very importantly, financing this is very important. The model that Dr. Olumide Okola talked about, whether we want a central approach or a hybrid approach, open market, closed one, it's also very important. These are things so all I would say is that we'll be engaging stakeholders further.
Okay, there is noise at your end there. Thank you, Dr. Adebola. Thank you. I would like also to tell our participants, please make your opinion count. Kindly take the survey that has been on the charts. Please follow the links below, and then we will attend to all your questions. In fact, there's a lot of questions have come in, and we are really glad that we all followed this webinar presentation. Please, while we are working on time, I'd like to recognize the president of PSN, Professor Cyril Osifo. He's here with us, and I would like to also request him to give us a goodwill message just for 2 minutes before we go to the wrap up for this program. Dr. Professor Cyril Osifo, please, the floor is yours. You're welcome. Kindly unmute Professor Cyril Osifo. Professor Osifo, the president, PSN.
Hello.
Yeah, Professor Sifo, please go ahead.
Yeah.
We can hear you clearly.
Well, I just want to very briefly, though we have an environment here, to commend the DG of NIPRIT for putting up this webinar, and also for the discussions and the conversation we're having concerning vaccines. I hope the conversation will not stop here, but we'll take it a little bit higher so that we can synthesize all the ideas that are put forward here, and together we can make a breakthrough that truly will start local vaccine production in Nigeria. On this note, I really want to thank you and appreciate for all that you've done. But don't forget, farmers to be highly involved in vaccine production. Thank you very much. God bless you.
Thank you very much, Professor Sifo. Thank you for the great job you're doing at PSN. We appreciate you again for being on this call. Thank you so much. On behalf of the DG, NIPRIT, we say thank you again for all the collaborations you have been doing with NIPRIT. On this note, distinguished ladies and gentlemen, it has been a very great day today. We've been on here together discussing, looking at expediting local vaccine manufacturing in Nigeria, the challenges, opportunities.
Welcome, sir.
Thank you very much.
Pharmacist.
Okay, thank you. Our DG, I think I can hear comment at the background there. Okay, thank you. Professor Sifo, you can mute. Thank you very much. Distinguished ladies and gentlemen, I think also I would like to please request the chairman of Pharmaceutical Manufacturing Group, Mr. Frank Moneme, to please just let's hear something from him also, just for about 2 minutes. The chairman, PMG, man, are you here? Mr. Frank? Let's hear your voice also. Please, you can unmute, please. You can unmute, please, Chairman PMG, man. Okay. We appreciate you, recognize your presence. Thank you for being on this call also. Distinguished ladies and gentlemen, a lot of questions are pouring. We promised you that all these questions will be used in our policy formulation drive towards expediting local vaccine manufacturing in Nigeria. There's so many that I can't read out. Many of them are very encouraging. Shows that we all have passion and we are all interested to make sure that Nigeria move forward. And we are also all ready to partner with the stakeholders, particularly the lead agency, National Pharmaceutical Research Development for Nigeria. On this note, I like to invite Dr. Abubakar Danraka. He is the Special Advisor, Technical, to the Director General, CEO of NIPRIT, for the wrap up and closing. Dr. Abubakar Danraka, you have the floor. Thank you.
Thank you very much, Professor Kola Olewalatunji, moderator. It's raining cat and dogs here, but at least I can hear using my earpiece. My task is very simple. I stand on existing protocol. Good morning, all participants, panelists, and the delegates. I'm to give a wrap-up, but I will not be able to do that without duly recognizing and standing on the existing protocol. Am I audible, Prof?
Very audible, Dr. Waka.
Thank you very much. Go ahead. We have successfully come to the end of today's interactive webinar. And as a way of wrap-up, the task of the webinar is to get the feedback of experts. We have heard all you have said and noted your comments. And as the moderator rightly said, the outcome of the webinar will duly be circularized and published. Then the major take-home will be the development of a roadmap for local vaccine manufacturing in Nigeria. In the last 2 hours, we have successfully had our panelists, especially the technical expert that spoke to us on the key thematic areas. It is good to summarize to say that we have elucidated that the approach we are taking this time around, knowing fully well that Nigeria had produced vaccines from 1940 to 1991, we are doing a total research gap analysis to see what were the challenges and putting in place sustainable means that will protect the issue of starting and stopping. So we are focusing on industrial access, demand-driven markets, and enabling environment. These three scopes will guide the entire roadmap that will come out based on the submissions made. I won't end my wrap-up without appreciating, as a vote of thanks, the panelists and the invited guests, most especially His Excellency Ambassador Yanko Yordanov and his team that have been very supportive in this process. Our Excellency Ambassador Samuela Isopi, who was ably represented by Mrs. Leila Ben Amo Mathieu, the head of section of human development in the EU, European Union delegation to Nigeria. I also want to use this opportunity on behalf of the Institute and the DG to appreciate our Special Advisor to the President on Health, Dr. Salman Ibrahim Anas, who found time to be on this call. And I'm sure she has taken notes, and also the feedback from this webinar will be shared to her for necessary implementation. We thank Dr. Ngozi Azuno, the head of Department of Health Planning Research and Statistics, for her insight. Indeed, this initiative will take into cognizance all other existing interventions that are ongoing, and we will factor all alignments to existing both national and international documents to facilitate access to vaccine manufacturing in Nigeria. We also thank the PSN president, our own Professor Cyril Osifo, for coming on board and sharing his thoughts. We appreciate His Excellency Ahmed Ibrahim Yakase, the former president of PSN, for his insight, and indeed we will work together and make sure that this time around it will not end in talk, it will be translated to action. Before I end my wrap-up, I must thank the team, Professor Kolawale Olatunji, for moderating, for the efficient coordination and the journalistic aspect of your presentation. We appreciate it. Dr. Ayeke Anthony, your technical expertise, we appreciate it. Dr. Olajide Adebola, and other technical experts that presented, Dr. Olumide Nola and Dr. Kenneth Abu. Appreciate all the top management committee members of NIPRID that joined the call, the research fellows that joined, and also all our delegates that participated far and wide globally and nationally. We are sure that all the inputs will duly be analyzed, and we call on all that have not filled the survey to take opportunity and share their input so that their opinion can count. Thank you for coming, and we look forward to more cooperation and answer our call when next we call. Thank you, and God bless.
Thank you very much. Thank you very much, Dr. Abubakar Daraka, the Special Advisor Technical to Director General, CEO, NIPRID. Thank you again for the wrap-up. Very brilliantly put together. I want to thank you for the time. More importantly, we want to thank our DG again, the lead agency, NIPRID, Dr. Obi Adikwe. Thank you for all you've been doing at that very, very excellent agency. We want to thank all those who have been part and parcel of this call since we began 9 a.m. And of course, as we keep to time. We told you we'll be ending by 11 a.m. And here we are. This is 11. On this note, I want to say thank you again. Looking forward to see you again in our future programs. Thank you, and thank you, and thank you very much. I think I have the DFDS raising her hands. The Director of Food Drugs, Pharmacies, she wants to make a comment. Director, okay, there's none. So thank you very much again. Thank you, looking forward to see you all. Thank you for your participation. God bless you, God bless Nigeria. In a very short period of time, we'll begin to produce our own local vaccines. Thank you very much. Over.
And thank you very much, Prof, for the wonderful moderation.
Thank you very much. God bless everyone. Thank you.
Please kindly
They should on their mic. Okay. Please, we request that all participants should on their video now. We request that all participants, please, you can on your video. We want to take a conference photo, please. Kindly on your videos. All participants, please kindly on your videos. You are free to on your videos now. Those still available, please on your videos. Thank you. Thank you. Thank you. You can on your videos. Thank you. You can on your videos, all participants, please. Thank you.